So how long ago did the pain start?
Started. It was on and off. Remember last year when last time I was visiting
It's actually
the
July
neck.
of 2 years ago.
Yeah,
So
so
whatever
the
we did,
neck was already like in this position, right? But it started going in this way, this
it's
direction.
starting hitting your
Yeah.
shoulder blade.
So now it hurts more in here.
Okay.
It still hurts in there
Of
when
course.
I pull down, right? Most of it. So it goes here. Some pain I feel in here.
Okay.
It goes all the way in.
And what kind of pain are you feeling?
Something like pulling.
A pulling pain. Any numbness, tingling, burning?
Yeah.
Okay. Like an ant's
Because of
crawling.
that, I get headaches.
You get headaches. Well,
I stopped drinking because I've been drinking Tylenol a lot.
okay.
I just stopped recently. 'Cause
Okay.
it's just like I drink
It
too
numbs
much.
the pain. It doesn't
Yeah.
take care of the problem. Okay. Well, like I've said before, pain and the body is a map. So it depends on where your pain symptoms and the type of pain and symptoms you're experiencing. It kind of gives me an idea of what could be the root of the problem. I mean, I would have told you what your diagnosis is, but unless I do have an MRI or some special imaging, I cannot say 100% it's from this, okay? But fortunately, not only do you have a report, we have the images here. So I'm gonna go ahead and explain it to you, because the more my patients understand, the better they know what to expect, okay? So this is more designed as the shape of the lumbar, the low back vertebrae, okay?
Low back,
But the concept is the same, just the shapes are different, okay? So here we have our vertebrae, all right? So if you look on this picture, these little boxes, you see these boxes? This is a side view like this, okay? So these vertebrae here are these boxes, okay? And then you have your spinal cord that goes in the back. And every level has a left and right nerve branching out, okay? So this spinal cord, this is your brain. And now this becomes the brainstem, and this is the extending downwards of the nerves, okay? Between every level of the vertebrae, you have your disc. And if you see here, it's like a jelly donut is the best way I could compare it to. The disc is actually the jelly material in the middle, and the dough keeps it nice and centered and plump, okay? The job of the disc is to absorb our shock. And it's more common for taller people such as yourself. Most of the time you're looking down at people, so you're putting a lot of strain on your neck and vertebrae. So this absorbs the shock, okay? Through years, trauma, like accidents, slip and falls, weightlifting, depends on what you do for a living. What happens if I push down on a jelly donut? Eventually, if I push down, the pressure will start tearing the dough, correct? When that happens, a weak disc, that's like more of a disc bulge. But if I push hard enough and it leaks out, tearing all the layers, okay, now that becomes a disc herniation. If it gets by textbook around 4 millimeters in size, it could start pushing on the nerve. And depends on what level, you'll get the pulling, the weakness, the numbness, tingling. But just because it's less than 4 millimeters doesn't mean it won't have other tissue pushing. So there's arteries, veins, ligaments that this can actually push and actually hit on the nerve, okay? So I'm gonna show you exactly what we're looking at. So this is pretty cool. Since we have both of these, you could definitely understand a little more. So again, we have your brainstem, your spinal cord, correct? These little vertebrae from the side view are these boxes, okay? These little spaces in between, do you see them? How they're dark and bright? Those are actually your discs, okay? We want them to appear white in this image. When it is appearing white, it shows that it's healthy and it has plenty of fluid. But you see here, where it's a little darker in shade, that means there's some injury or desiccation, we call the term. Some of that fluid has leaked out, okay? It's dried out, okay? So these are where the injuries are, okay? And then let me go to, okay, here's a view. You see how it's nice and smooth of a line here, okay? There's not too much compensation. And then do you see here, there's an actual like balloon or bulge? That is actually this pushing on the nerve itself, okay? And this is the level of 2, 3, 4, 5, and 6. So this is your C6 level. So that one will actually start. C6 disc is going to start shooting, could be to the arm, or that is your actual shoulder blade plane. So if anybody out there, if it starts compressing C5, C6 in the neck, it's the nerve above. So you're going to get more symptoms on the C5 nerve, which C5 is all shoulder blade, okay? And now if we keep moving, you're going to see more. So right here we have the third one has a little bit of a bulge, and the one below, you could tell it's worse than the one above, correct? Okay, and this is just one slice. So now when I go to the next image, it's a lot better here, but then 2, 3, 4, 5, and C6, which as of right now, it appears as the worst one. That is definitely, I would say, at least a 4 millimeter. And even if there is a bulge, there's times where it doesn't actually press on the nerve, but you could see right here this not this white stuff, the middle darker, that's your actual nerves. So if you could see here, that is definitely compressing or pushing on your nerves, right? And that's why you're experiencing all these symptoms. I know it's hard to understand, oh, why are you treating my neck if my pain is in my shoulder or my arm? But the root of the pain in the arm is all neck, okay? So we're going to do some decompression therapy like I've done. Oh, man, this fourth one is there too. Right here, hold on. Right there. See, it's pushing down. But it's treatable. Obviously, you're taller, so we just got to give you some strengthening and exercises at home just to take care of it. Okay, so yeah, C6, 7. Okay, so you have a 2 millimeter disc bulge at C3, 4, which the referring, the mapping where the area it does take over or control is the neck. So that's the area of the neck where you're going to feel the symptoms of that. C4, 5 is going to be more of this right here. Okay, and C5, 6, which is a 3 millimeter. C4, 5 is a 2 millimeter as well, but it's a bulge, okay? Again, that means a few layers have been torn and it's weakened, okay? But that's easier to treat than a herniation, where it tears all the layers and it starts leaking out. C5, 6, you have a 3 millimeter and it's a protrusion, which it's between a herniation and a bulge, which means you're almost at the last layer. So you came in at a good time for that. Okay. But then C6, 7, which it affects the C6 nerve, the median nerve, you will be feeling on these 3 fingers and half of this. So if you get the numbness tingling right here, okay, luckily that sensation is the first one of the earlier stages. Eventually, if you start experiencing the weakness or atrophy, which is loss of muscle mass, that's where it's severe. But luckily, you don't have that yet. 4 millimeters. So with the decompression, I'm going to focus more on the 5 and the 6 level. Okay, the 2 millimeters are still going to improve whether or not I focus on them by when I pump the C5 and C6. Okay, so we're gonna decompress your spine. We're going to do some muscle work. We'll start with an ultrasound, which is going to heat deep to the bones where the ligaments attach, okay? And then we're going to do some muscle work to get rid of the headaches. Can you tell me where you're feeling your headaches?
Pretty much.
Well, is it all over? Is it the sides? Does it go to the eyes?
I would say, right here.
Okay, so that's more trap levator trigger point referral. Okay, do you have any questions for me? Look, another thing, I can't guarantee or tell you how long it'll take, but obviously I would recommend 2 times a week initially for maximum benefit. Okay, but what you're gonna feel is now your pain is in your hands, right? Because that means the pain, the herniation is hitting the nerves. As I stretch and open this up and rehydrate, this will slowly decrease in size. When that happens, you're going to feel this pain less and less and less, okay? And then eventually, this arm pain is going to go back to the neck. And there's going to be a moment where you're going to experience more neck pain than arm pain. And I'll tell you why, okay? once I get this to a smaller size, do you see how there's no more pressure on the nerve, but you still have a little balloon out, right? So that means no more nerve pain, but you're gonna feel localized pain where that bubble is. And then within a few visits, that also goes back, okay? And it's very hard, and I know you're gonna do it too. Doc, I'm getting worse, my neck hurts, and I'm gonna ask you, are you feeling the pain in your arm? You're gonna say no, and I say, I'm gonna remind you of this conversation, okay?
But mostly pain is on this side, on the back.
Okay.
Sometimes, because usually when I move, mostly pull down, and that's what it's pulling me here.
It's pulling.
Yeah, and one day was, I believe it was last Friday, when I woke up, it was just painful. I didn't even move. It was just like hurting. Yeah, that's the shoulder.
Were you able to lift your neck off the pillow, stuff like that? Okay.
Hardly. Yeah, that's why I went emergency. They gave me some shots.
Do you know what shot that was? Steroid catalog?
Yeah, I know.
Okay. All right.
That was pretty bad.
I'm gonna ask for a request for medical records just so I see what they gave you. I'm assuming it helped.
Medical. I don't really have any.
You say you went to the hospital.
The emergency?
Yeah. They didn't give you any like discharge papers?
Maybe she
okay.
has it. Yeah.
We'll talk to your wife. All right. Let's do you have any other questions for me?
No.
I mean, you came for similar problems last time. Looks like we got you better in one visit. I mean,
yeah.
So
you know what? Actually, that visit helped me. Maybe I felt like, okay, it was like couple days, like nothing really changed.
Okay.
But it slowly, I started like, and then I realized after 1 month, hey, actually, I don't have a pain in my neck anymore. You know?
There you go.
And then all of a sudden
it could take a few days, okay? Again,
1 day treatment.
I mean, maybe I'm too good for that, but that's what we want.
Magic touch.
Because the less treatments I have you come in, you save money, you save time, and you're more likely to refer. If I could do more and get you better in less visits, that's.
So how many treatments do we?
I cannot guarantee it, okay? Again, I'm gonna do my best to have you come one time and in a month realize you don't have pain again. But I would say at least give me 4 to 6 visits in mind, okay? If you do twice a week, you'll get better faster because you'll come in, once I decompress this, okay? After a few days, it's gonna start going backwards again. So if you come in before that 3-4 day mark, we could improve it more before it gets worse, okay? But again, I'm gonna do my best to make sure I don't see you for 2.5 years actually. So that was pretty good. 1 visit for 2.5 years, I mean, I'll take that. All right, Dimitri, so let's go start you off on the treatments, the muscle work, and then I'll come in and decompress you, okay, buddy?
Let's do it.
All right.